There are many causes of dementia, and today we're going to talk about one type of dementia called Korsakoff syndrome. And here to help us understand this disease and its causes and treatments is Nurse Christina Paris. So hi, thanks for joining us this morning.
Good morning. You did a better job with that name than I have.
Thanks. I tried. I was really guessing there. All right. So first off, what is Korsakoff syndrome?
So Korsakoff syndrome is a type of dementia, and it's caused by a thiamine deficiency, which is B1. And if you remember, to our viewers, I talk a lot about how every cell needs carbohydrates and we need sugars to metabolize and help us think. So this is one of those disorders that you're unable to metabolize those sugars. And so there are a lot of different things that can cause it, like heavy alcohol use is like the number one. Some people will even call it like alcohol dementia. But you can get it from eating disorders, so your body's not absorbing any kind of thiamine. Maybe if you have bulimia and you're eating, binging and purging. Chemotherapy, Crohn's disease, things like that.
So there's not like any one specific thing, it's there could be multiple things.
Correct, but it's most closely tied and associated with alcoholism.
Okay, and then are there any distinct symptoms that would differentiate this from other types of dementia?
There are. So you're going to have irreversible memory damage. So you want to be really careful and try to catch it early. You could experience hallucinations, so seeing things that aren't there. Having repetitive speech, so people who will tell you stories over and over again because they don't remember. Decision making, lack of motivation, and it's not that they're just lazy, it's that they can't process things to move forward. They'll have difficulty with memory, both short and long. They may think they've been somewhere when they haven't. Like you may say, hey, I got a new car, and they're like, yeah, I saw that. But they didn't see it because it's brand new. So they just don't remember. And so the brain fills in, and it's called confabulation. So your brain, when it can't quite sort out all the details or can't remember, it will fill it in. So these people aren't necessarily, they're not lying, and it's different from being a pathological liar. They just, their brain compensates by making up stories.
Like they genuinely do think that they saw that.
Correct. Yep. So they'll make up things.
Yeah. How is it like diagnosed and treated? Is there like a certain age that this?
So there's not, and it can affect women and men, and sadly, because it's kind of new, and a lot of people don't even realize that they have this issue, especially if somebody is heavy into alcohol, they pushed away their family. So, but diagnosis, you want to go see your provider. They can ask you questions. They can do blood tests for thiamine, and that's going to be your big treatment. You're going to give them B1, either injections or they'll get B1 orally, and then you can do some kind of memory rehabilitation and treating alcoholism. One of the big things I just want to say really quick is don't try to stop drinking on your own. If you are a heavy drinker, you need to see your provider and get some help because it can be serious and life-threatening.
So like cold turkey is not the way to go.
Not for somebody who's heavy, who's a heavy alcohol drinker.
So then like taking away the alcohol, that could help like with a lot of improvement? Or
it can, right. So you can have improvement, and if you catch it early enough, you can stop the damage from getting worse.
Okay, awesome. Yeah, well, thank you so much. I definitely think that's very important to kind of recognize those signs, especially because some of those aren't something I would necessarily think of. Again, like kind of that filling in the details type of thing.
Yeah.
So thank you so much for joining us this morning.